My name is Anna and I welcome you to my home. In today's program, the first question I would like to ask you is, when do you think is the right time to start taking care of your health? And the answer is, right now. And my today's guest is the best person to explain this to you. And I can't wait to introduce to you my friend and famous sport therapist, Dr. Ali Hussein. Hello, Dr. Ali, and welcome to my home. I'm really happy to see you here, and I'm really glad that you made some time to visit me and tell to our audience everything about sport therapy, health, and exercise in general. Welcome.
Hello, I'm glad to hear you. Thank you.
All right, so the first question everybody might be wondering right now, what is that exactly you do?
Okay, so I'm doing a kind of treatment for the patient through exercise, sport therapist, and soft tissue dry needling for other patients who've got cases like a back pain, lower back pain, shoulder pain, any kind of joint as well.
All right, because for many people, I think they know that when you go to the doctor, you take a pill, and then maybe you got something to treat you and you feel better, but nobody really knows about the therapy and how that works. And also, I know a lot of people, they want to have the treatment done just in one session. So can you explain how does the therapy works and this kind of treatment?
Yeah, first of all, we can, education for the people to know how physiotherapist is or sport therapist is. Most of the people, they thinking when they got a problem from for example, lower back pain, they're not going to the doctor. They will leave it for a while, probably like a month or a year or 2 years. And then afterward is be like serious problem, then you go into the doctor, they give you medication and might be not help them because it's been a while. Through this time, they can come to us, they visit into us, we can care about help them, and we can diagnose it by some supervision of the doctor to know what the problem is. Then they refer it to us, and then we can have a look at the situation, how long you've got it, and watch the way you've got the problem, and then we sort it out by different way. For example, we might be using like physiotherapy, and we might be using like dry needling, we might be using like a sport massage. This is the way they can help patients. So
to treat their physical body from the outside, but also it affects the
inside. Okay.
Yeah.
So it's not only when we doing a superficial, but we have a deeper as well. So for example, when you're using dry needling or fishing dry needling, they can go deeply, and even they can affect your all different feedback, which is the signal they can transfer to your brain, and the brain they can produce natural product. For example, ibuprofen, or that can help the muscular, can make them relax, and also they can improve the neuro disorder as well.
That is interesting. And you just mentioned 3 ways of treatment.
Yeah.
Which is dry needling?
Dry needling, soft tissue, and physical therapy, we call it. And also there is another way which should be recently focused on it, which is a chiropractor, or we call it manipulation of the spine. This is the best way as well. We can, treating the patient, especially when you've got a problem within your joint, or maybe we have a stress in the muscular. We can release all the stress on the muscle by a chiropractor.
So could you please give more examples on each of these ways of treatment? What are the dry needles? If you talk about dry needling, what are those? It's like regular needles you can find in the store, or how does it work?
Yeah, so dry needling is similar to the Chinese needling, but the process or the way you use it is completely different. Okay, which is the same stuff, but you will use it in a different way. So when you put in the dry needling on the muscle, you will try to put it like 2 to 5 or 10 times in one dry needling, And then this one, when you put in the area which is being affected with the pain on there, okay? For example, if you've got trapezium pain, okay?
Yeah.
That's a trapezium pain. You will put in the dry needling on there. And this one, how it works, so because many patients or many people, they tell me, oh, how it works, it's only dry needling and there is nothing on it. There is no medication. So what they can, can work.
How they can cure me, right?
Yeah, okay. Or even like if some of the other people, they can scare, which is really painful. How can I use it?
I'm already in pain, and now you're going to stick a nail into my muscle. So
yeah. So
how does it?
Yeah. So how you can just say it's work? So when you're putting in this area, which is really painful, like for example, like trapezium
So right
muscle.
now it's here, right?
Yeah.
So if I have pain right now.
Okay, yeah. So I'll put in there exactly, and I'll try to put it like too many times.
So several times.
Yeah.
Just put it in and out.
Yeah. So it's like I put it in different area. Okay. And when you see the problem is, then you will feel pain. Okay. If there is no problem, you're not feeling that much pain, or even you're not feeling pain at all.
So
okay.
let's explain that the needles are very thin.
Very, very thin.
Because the needles, which you can usually see somewhere in the market, and you think like, oh, that's the needle. Even the needle for injections are very thick. These are like maybe 10 times thinner than that.
Yeah.
You can barely see them, right?
Yeah, okay. And what is that process? You will, feel the pain there, and then the signal, they go to the brain, okay? So like there is something like being in your body, which is strange, okay? And in that way, the brain, they can produce what I'm saying, natural painkiller to that area. They can relax all this muscle, because people who feel in pain for trapezium is definitely stress on the muscle. When you're doing that, they can all making relax, and that one you're not feeling that much pain.
So basically,
afterwards.
you directed the blood flow into this area, which already contains natural medicine produced by your body.
Exactly.
This is so interesting and exciting.
Yeah, so that's just like you can compare with the medication.
Scary.
No, it's not that much scary, and even it would be an alternative way to medication. So like your medication, you're taking a tablet. The tablet, they can,
you wait hours.
Yeah, so it's like, so that can affect you, maybe stomach, your kidney, okay, liver. That also make you a problem in your future, okay, and that can take a times, okay, to signal signal to your brain, and then they can produce that painkiller. Mm-hmm. But if you're using the natural things, and it would be immediately or after like 6 hours, you can be treated by painkiller naturally.
So this is the clear example of how our bodies are powerful and they can cure themselves if you pay a little bit attention to it.
Exactly.
Thank you for this explanation. Now it's clear to me, and I'm sure it's clear to everyone who's watching right now, and I can't wait to try that treatment one day. So what is the next? We've got dry needling. What is the second one?
Soft tissue. So we have different kind of an instrument, which is made from the steel, which is so clean, even like bacteria can't be on there. So when you use it in the muscle, they can increase blood flow to that area, which is normally working in the area which is painful. So you can do it either way. This can increase blood flow to your muscle, and muscle can get relaxed, and also they can increase kind of medication as well by naturally painkiller.
So basically using some special tools
on
the skin, on the surface of the body, right? Like massaging it in some specific areas. And then again, you send the blood flow to that area.
Yeah.
And that's called
soft tissue instrument.
That is also one interesting.
And even like, they become your body more mobility. Mm-hmm. So because if your muscle getting not stress on it, you will be more mobility to move in the natural way, so that you can benefit from the instrument.
What is the next way of treatment?
Okay, so basically which I'm using it as sport therapy. So sport therapy exercise is really important to give the patient at the beginning, which would be during the process, physical therapy, or would be afterward. Okay, so that's a question I can ask everyone. So it's not really important you use the exercise at the beginning. First of all, you need to check the patient by the doctor or physician like rheumatology, they can ask you, yeah, this is would be able to do exercise with them or not. Okay, when they come to you, when you check out with the patient how his muscle works, in that case you will be able to do kind of exercise. If it's not, it shouldn't be used exercise, because sometimes you will be spinal cord, like a pressure on the spinal, so spinal cord. In that way, you're not able to do exercise with the patient.
So let me make it clear as well. We've got a patient, right, and then he or she suffers some pain.
Yeah, okay.
And a lot of people might recommend, oh, okay, just get everything and go exercise straight away. But that's not the right way. First, they have to go and get the diagnosis from a professional doctor, and then they come to you as a therapist to treat that issue. So it's important not to skip two steps, right? So it's important to get the diagnosis right and then find the correct treatment.
Yeah, exactly.
So, and that called sport therapy, right?
Yeah.
Now I know that today we can demonstrate some of the exercises on one of our guests here as well. So how about we proceed right now and then show our audience how this actually works.
Yeah, right. And the other treatment, which is recently we focus on it, which is a chiropractor. So chiropractor, it is important, but you should be a professional skills how to use it. That's an important thing as well. So most of the people, like before, like in maybe like 100 years ago in Kurdistan, there is a kind of people that using it, chiropractor, without any education, without any like certificate. But the new days, there is this specialist being improved. Most of the chiropractor, we call it the chiropractor, they can use the manipulation of the spine, of the shoulder, or any joint of your body. This can work. They can release kind of medication as well. Or even if there is a muscle tone being stressed, when you're doing the chiropractor to the muscular, then can release a lot of that. And also there is a theory of that. When you're doing a chiropractor to any area of your body, we have a theory gate of control. So gate of theory of control of pain. Yeah. So we've got in your body, we have afferent and efferent feedback, which we call it like a big fiber and small fiber. So a small fiber would be signal pain to your body to see there is a problem in your body. When you do a chiropractor, they can stimulate the big fiber, which is they close the gate. You're not feeling that much pain. It would be reduced. It's as simple as a medication.
So basically, what I understood right now, we've got 4 ways of treatment.
Yeah.
It goes from the micro tissues in your body to the main skeleton and bones, right? Yeah. So what is the treatment you're going to demonstrate today?
Today, I'll focus on the chiropractor, which is really important.
So basically, the bones and the spine, right?
Yeah, we call it like a manipulation.
Yeah. All right, so how about we proceed right now, and then we have our guest there, and then our medical bag ready.
Okay, yeah. Okay, great.
All right, let's
go ahead.
All right now we are ready to demonstrate some of the manipulations which can beneficially affect the human body. And now, Dr. Ali, what exactly are we going to do right now?
Okay, so this is an example which we've got a neck pain. So just to tell you, not everyone can do this. You should be professional on this, and you will be educated, and also you've got a lot of course on it, because this is dangerous if you're doing it, wrong way. You should be very careful to do it. When you do it, it's not any pain to the patient as well. So you will have a look first to see. Just relax. To see where is the tone is getting in your muscle, okay? And then what you can do, you can just turn. Relax. That's the only one.
I heard something.
Yeah, so we call it cracking, okay? Or pop or cracking. This is only when the same, this one, you can just put your hand and over there, relax.
And again.
Yeah. And being like, all muscle being relaxed. So that's a continued signal to the brain, and then they produce natural product, ibuprofen, to their muscle and be relaxing. So there will not be any tone in the spinal.
So now basically it was a good cracking, right?
Yeah,
Beneficial.
definitely.
So how do you feel right now?
All good. All good.
All right. And you mentioned earlier that it's very important not to repeat this at home. But I see, and I know a lot of people, a lot of friends of mine, they keep on cracking their necks by themselves, twisting it, and then you can hear that.
Yeah.
So what can you recommend to those people who actually like doing that and then still do it, keep on practicing that?
That's a good question. Yeah, actually I can see many people, they cracking themselves, which is not a good idea. Because with someone, a professional to do for you, you will be relaxed, okay? And then he'll do it, and the action would be okay. But if you do by yourself, your muscle tone, it would be in stress. So because when you do it, it will be in stress, you can't crack it. If you crack it, you will be hurting your spine, which is no good. And when you do it day and after day and after day, then you will get maybe prolapse, or you get a lot of problem. But if someone like a professional, they can do it in different way and in the correct way.
So I see what you're saying. So if now I want to crack my own neck, I am already standing or sitting straight, and I'm using my muscles.
Yeah.
And if I crack or turn, I will hear something, and I will think that, oh, I did it, but in fact, I injured my own muscles or joint.
Yeah, spine.
Everything,
yeah,
right? So,
spine,
but when you do that for the patient who is relaxed on the medical bed, that's the right way to
Yeah, exactly.
All right. So also, I know that a lot of people, they have this issue, especially with their neck, because they're not sleeping in the right way, or they're using really bad pillows. So could you please recommend something on that?
Okay. So we have like a medicine pillow, so we can use it for the patient. That is the good way can use it. And there is other pillow, especially people they using like are really high, which is no good. So you should put a pillow which be be normal, your spine, and be straight, not to be up like this, or you can sleep like this. And this one, because you will sleep, you know, what is going on with your muscle. That has been turning muscle because it's been really high. Or you're doing that, they can hurt in that one. This it can causes, we call it, like bulging to the desk. This is getting bulging. This bulging, they can affect you spinal. They can pressure on it, and that way you will feel a lot of like numbness in your hand, or you can't use your hand correctly. You might be unable, or you might be not strong enough to use your hand, because every problem would be because of your neck, because you're not sleeping properly. You don't have like a pillow correctly, and then that's why you feel a lot of pain.
But not everyone would like to buy a medical pillow. It's a very rare case people would go and purchase a medical pillow. But could you one more time please demonstrate the height of the pillow, so the position on the head? Now he doesn't have a pillow, right?
Yeah.
So some people, they sleep without pillow. Is it okay to sleep without?
No, you can't sleep without, because if you look at here, there has been problem. You should make it like this, okay, to be normal in your spine.
So it has to be neutral position.
Natural position.
So not that high, not that low. And sleeping without pillow is not really good for you
No, it's not really good.
How about people who like to sleep on their stomach?
Oh, that is no good way to sleep at all. You should sleep on your back or on the side position. That is okay. But if you sleep in your side position, should be pillow, would be your spine to be straight as well.
Okay, that is great. So that was my question most of the time. So not only posture while you're sitting is important while you're walking, but also sleeping position is very important for your health, because you spend like 8 hours, 6 hours during the night, and if it's not correct, it affects the whole posture and then the general condition of your body. So we just talked about the neck pain and the shoulders, tense shoulders, and all the problems connected to that. But also I know that the second most popular case people come to you and then suffer from, it's lower back pain.
Yeah, exactly. So there is some people, they feel like lower back pain. Okay, so we have different kinds of lower back. It might be sciatica, it might be prolapse, it might be just muscle tone. So it is like if it's sciatica, when the doctor did refer to there is a sciatica, in this way you're not doing chiropractor on it. So that's be very, very careful because it would be in the nerve. You're not cracking the neck. Okay.
Could you please quickly explain what sciatica is? Because a lot of people, they don't know. They hear it, right?
Yeah,
But they
yeah.
have no idea what it is.
Okay.
You can even demonstrate here. So even
Okay.
I know that it's a nerve which goes from...
Yeah. So when you've got a sciatica, you will pain started from head, and then they getting down to your leg and to down. Okay.
All
so
the way to the heel, almost. So and you barely can walk, right?
Yeah.
So
you can't walk. You feel a lot of pain. You might be feeling numbness. Okay. So if you've got sciatica, we are not trying to do it manipulation for your spine, because you can't get a benefit, right? You might be affect your spine. Okay. But if there is like maybe a bulge or simple prolapse, or it might be issue with the muscle disorder, in this case I can try to do manipulation.
So once again, sciatica is the longest nerve in our body, and you cannot fix the nerve by manipulating the bones and the spine. So
exactly. That will be by medication.
Yes.
Yeah.
And some rest, right? Because a lot of people, they should know that sciatica is a very severe case, and if you feel pain starting from your lower back all the way through the whole back side of the leg, that is the case when you need to see a doctor, not just leave it as it is. Okay, so lower back pain.
Okay, now you are trying to do a lower back
pain treatment or the manipulation?
Manipulation. So we're trying to use manipulation of the spine, okay, for the lower back. So we will be on the side in a safe and correct way. This leg will be straight, okay, and this hand will be over. And this one should be straight. You can't try to be like this, which is no good for the spine, to be that one. And then you will put your hand over there. We have two ways. One way we can do for the sacrum, okay, this way, and the other way we can do it for the lower back, like L4, L5. Okay, we will try to do for L4, L5. Put your hand, relax, breathe in, breathe out. So when he breathing out, then you will try to act manipulation. Okay, breathe in, breathe out. Okay, so that's it for the lower back. So it means there is a lot of stress on whole muscle in that area. Okay.
How are you feeling right now?
You're fine. Okay, great.
And then you only do it on one side, or you have to?
So I'll try for a different way. I'll try to focus on the sacrum as well. So it would be inside the other side. So it should be pillow over there as well. You can't use it without pillow.
Yeah.
Okay. It should be spinal straight. Okay. This is we will do the same process. Okay. Then you put your hand there, and you will try to put your hand over sacrum. Just trying to breathe in, breathe out. That is for down for the sacrum. You will do it. Okay, we call it like S1 to S5. It's a different way you will do, which we did previously for the lower back.
So now you demonstrated two cases and then two different areas which been treated and manipulated, and I hope now he feels much better, our patient. So one more important question. As I know, a lot of people, when they wake up or after the treatment, they're laying down and then they just stand up straight.
Yeah.
Now I want you to explain to everyone who's watching right now, it is very, very bad habit.
Yeah.
You've got to turn on the side.
Okay.
And then lift through the side.
Yeah. That's a good question, honestly, because most of the people, bad habit, they just wake up, which is, that is not good way. The good way, they can do a correct way, he will be on the side, this could be inside, okay?
So before you get
so
turn on the side.
So then he will try to leg down, and then down again, and just wake up. That is a simple and easy way, because the weight is getting less. In this way, you can wake up. There is no problem at all in your lower back. But if you just wake up, that's no good.
And sit up straight, because you've done all the treatment for the lower back, and then you wake up and then sit up straight. everything.
So you did nothing.
Exactly.
Yeah,
So
exactly.
it's very important for everyone who's watching, guys. Be mindful when you try to stand up. First, turn on the side and legs down, and then sit up straight.
Yeah.
All right, so now we just demonstrated some manipulations which could be only performed by a professional therapist. Thank you, Dr. Ali, for showing all of this to us.
You're
But
welcome.
now I have a question. What if someone watching right now and then have some tense shoulders
yeah.
or any other problems? Is there any exercise you can recommend that they can perform by themselves right now at home?
Okay, yeah. So after you finish your physiotherapy session, and when we're doing a chiropractor to them, and when we feeling he's really good, then we can do a simple exercise. We're not trying to do hard exercise, because that's just not good things, because I can see most of the sport therapists or physical therapy, they're trying to give him exercise which is hard. This is no good, because what we can do now, I'll try to show which kind of exercise, simple exercise, we're trying to focus on it, especially which is a stretching exercise. And I try practice to the patient. Okay, so if you just lay in your back, please, for me.
So it is important to understand that
Exactly.
they have to build the muscle strength from the beginning. That's why no strong activities. Right?
Yeah, exactly. Most of the, stretching exercise we do it for the patient. We will try. He can just pull his leg to his chest.
So knee to chest.
Yeah. So you're not trying to be more than 10 seconds. So it only would be less than 10 seconds, because it would be getting spasm, which is they can affect. Okay. So that is a 10 second. You can do it, and you can do it for each leg 4 times. Is enough. And you can do it in the morning and evening. With the same, you can try to do it both sides.
So this simple exercise, if you look at it, affects the whole body, right?
Yeah. So
shoulders,
yeah.
spine, the lower back.
Yeah. So even like his neck is in relax, not trying. The second exercise, we're trying to focus on it. He can do it at home, which is as simple as well. He can try to put his leg over there, and he can try.
So
Down the same.
We call it figure 4 in yoga.
Yeah. Okay. That is really good, because you stretch hamstring muscle. Okay. And with this can reduce pain as well, and can increase blood flow to all muscle. Okay. And you're not doing it more than 10 seconds, and you're trying to do that. Next
you see,
leg.
a lot of people, they think they have to spend hours. No.
No.
Just this simple exercise.
Simple
really
exercise. That's the only way you can do. Okay. We can try to do another exercise, which is simple as well. You can try pull both of them. This one as well, because they make your spinal to be relaxed. Okay. This one can help a lot to increase blood flow to your muscular. Okay. That's
right,
just,
so
3 exercises, simple. You can do it, and even like if you're not, if any times you feel a bit pain, you can do kind of exercise simple way. It's not affect at all. You will get a benefit. Okay, but if it's a seriously problem, no, in that case you should, diagnosed by the doctor, and maybe through the MRI or X-ray. Then he is back referring to us. And then for this situation, we are trying to do physiotherapy to them, or maybe soft tissue, okay? And when it's getting better, then we can try and manipulate it. After manipulating, then we can do kind of exercise to them.
So it's important not to start the exercises if you feel some severe pain in your body. First, get the diagnosis first, manipulations, and then get back to the exercise. All right, thank you so much. It was really clear. Now I also learned a lot through this demonstration and everything you explained. Now I think we need to take some rest and have some coffee.
Okay.
Because I've got some more questions for you to ask, and I'm sure our audience really excited to hear the answers as well.
No problem at all.
All right. So Dr. Ali, as far as I know, you came a long way to helping people professionally. From the Hulk, you had to travel to the UK to complete your education and to achieve your degree, and I know that you spent a lot of time and put a lot of effort into that. So could you please tell us about this journey?
Okay, so I finished a sport department and graduated like a bachelor degree, And afterward, I did get a master degree in exercise physiology. And then I found like we have got a lot of sport injuries, so we don't know how we treating them by professional skills to get them. So I thought like if I'm getting a degree in different country, can get a lot of information how to treat this kind of situation. So I've been in the UK by scholarship by government. So I choose University of Kent, which is the top university in sport and exercise sciences and sport therapy. And in this university now I've got the PhD, which is 4 years. And then I became like a sport therapist. And then I back into home to helping patients or sport injury by different kind of treatment which we talk about here.
Yes.
So it's not easy to get in like certification from this like sport therapy, and I think I'm the only one I have the PhD in sports science, sports therapy in the UK, which is from the top university.
And what also impressed me is that you went to the UK to study from Kurdistan.
Yeah.
And you did not speak any English.
Oh yeah.
And now your English is perfect. So you not
you.
only can treat patients who speak English,
Yeah.
you not only studied all this, you wrote a lot of papers,
Yeah.
right? And then you have your own researches done, also
Yeah.
written in English. So can you tell about that? How did you manage that,
Okay. To be honest, it's really hard. Like if you're going to the UK, you're not speaking at all. It's really hard to learn this, new skill language. Okay. Basically, when I've been in the UK, I couldn't speak at all. So only I can understand. And then, like when I had a course language in 6 months, I'd be able to speak. And then I had 4 months with the professional course, which before you go into your academic, you should have to know to skill like of reading, writing, and speaking. Listening. So I've got all of them. So what I'm saying is you would be never say, oh, I can't speak English. No. Even in whatever your age, wherever you are, female, male, you can learn.
So your age was 36 or 34? It's been like 12 years ago.
So now I'm 40,
Yeah.
40 years old. I graduated, I think, from 37. So this is 3 years I can do my job here.
So basically, when you went to the UK, you were
33, 30, yeah.
So 7 years ago, you didn't speak any English. And now if somebody is watching and you guys don't think that you can achieve or accomplish something, here is a life example that you can do at any age, right?
Yeah.
And that is very impressive.
Yeah.
All right, so also, I know that after you got your degree, you taught a lot at the universities here.
Yeah.
And it's a lot of as well, it's a lot of help to our society here, right? To teach and share your knowledge with people.
Yeah. So I can say, I can add, Annie, there's something for you as well. So when I've been in the UK, I've been at staff for university as well. So I taught a student in there.
So you started teaching there while
studying. So that's I even started like a model of professional scale. And then I've been a supervisor, some student, a master and bachelor student, how to use in the lab physiology, exercise physiology in there as well. So I've been all this information and back into my home to serve my country, okay? And even I have offer in there, but I wouldn't. I said no, I will back into home to serve my country. This is the most point.
And it is very impressive.
Yeah.
Thank you for that.
Thank you very much.
I hope that this story will inspire a lot of students as well. Travel to different countries, learn, and then bring this knowledge back to Kurdistan in order to develop and grow together. All right. So also, you mentioned that UK system. Let's talk about education right now in our schools.
Mm-hmm.
So. Teachers and schools in the UK, they're focusing on the movement, and they make sure that classes, that students got to move in every lesson. Doesn't matter. It's not only PE.
Yeah.
So, can you tell about that a little bit more?
Yeah. Okay. So in the UK, probably they focusing on the activity of movement. So it's not only you sitting and you study. They're trying to give you more different kind of activity just to move, to focus on movement. Because if you're not moving, you might be getting problem, which is the same people getting lower back pain or leg pain or shoulder pain. But if you are more active, because they teaching you, they adding to your culture, which is sport or movement, it's important because we call movement is medicine, okay? It's a medicine because if it's medicine, they can help you a lot. You're not getting that all of the problem in your future. Because in the UK, I can see they learn children, exercise, sport, movement is important to their life because when we came in older. But if you back into my country to see that we can't see this kind of culture to our country.
So here it's a little bit neglected, right? So
Yeah.
now you have a chance to advise to our parents and teachers as well that you can always implement some activities in your daily routine, at home and in class. Doesn't matter what you teach. You can teach English and also have some exercise and activities with the children. Ask them to jump, maybe go towards the board, write something and sit back. So that is an important message. What can parents do at home to get their kids moving?
Okay, so this is different kind of an activity they can do it. Well, the important things is they can educate children how to make a movement, to be active, to be away from the, like mobile stuff or computer, trying to movement to do, to go to the playground, to do kind of movement and walk and, trying to run. That's all stuff you can do. So if you're not teaching your children, and I think your children be at home, they feel a lot of pain in the future.
So it's adults' responsibility to get kids moving. So please be mindful about it and start doing it right now, today. So, and I always like to ask questions about values. You listed a lot of very important values in your life, which includes family and work, and the most important was health.
Healthcare is important, okay, to focus on it, because if you become unhealthy or illness, you will know how health is important. So why you to be in this state? No, trying to focus on your health, to be healthcare, to be more activity, and also you should be happiness.
Happiness is important.
It is important,
so, but
honestly.
You have your own great example. First of all, you just said that you're 40 years old, and I think everyone who's watching, they would not give you this age. One more thing I know about you is that you got diabetes, and you got diagnosed 16 years or 13 years ago, and then you still keep on supporting your body, and that's why the first value which you mentioned is health and then self-care.
Yeah, so healthcare is important for myself because I'm a diabetic. If I'm not doing any kind of stuff of exercise, I'll be older. It can affect my diabetic. So I'm every day, trying to make a time, because I'm always, when you're asking the people, I don't have a time to do exercise. No, honestly, leave it. You can make a time. Make a time for yourself to do kind of exercise, even like for 1 hour or half an hour. So, it is important you make a time, because people, they say, I don't have a time, honestly, but you can make a time, because every day you should make a time, like a half an hour to 2 hours for the exercise. You can be healthy, happiness, energy, responsible as well. You will be responsible to managing your time. That is important as well. So if you have all of things, you will be younger, and then you will be more energy.
And this is very important.
Very important.
Thank you so much,
You are
Dr.
very
Ali,
welcome.
for visiting my home, for all the demonstrations you showed to us, and I'm sure that program will teach a lot of people a lot of good things, how to take care of yourself, how to be motivated and achieve your goals, and also starting taking care of your body right now. And make sure that whenever you have a problem in your body, make sure that you actually go and see the professional therapist and try not to manipulate your body by yourself at home. Sometimes it could be
dangerous.
traumatic and dangerous. Thank you so much.
You're welcome.
And I'll see you soon.